How can counselors address the stigma around mental health and seeking therapy?
Just simply by normalizing it in everyday conversation, and realizing that therapy isn't just for the people that are struggling with really severe mental illness, and that it really is for everybody. Example I like to use is if you've ever cleaned your floor spotless and you spend all day dusting and mopping, and then you cut your Roomba on and you're amazed at how much extra stuff that Roomba will pick up after you just cleaned. And so I think it's really just for everybody. And I think we're getting better at destigmatizing it a little bit, but I think just being open and honest about our struggles and our experiences is probably the biggest step towards destigmatizing and normalizing.
Yeah, that makes a lot of sense. And then what are some signs that it may be time to seek professional help?
Well, certainly whenever you're feeling overwhelmed in life, or perhaps you're in a major transition, or just having difficulty coping in ways that you might not have before. But really the answer is whenever you're ready, whenever you feel like it's time, and listening to the people around you when they might encourage you to seek professional help. But you just, I think, have to kind of listen to yourself and ask yourself, what is it that I need?
Mm-hmm. How do you approach building trust with clients, especially those who are different from you?
I can say when I think on my career, some of my favorite therapeutic relationships have been with people that really didn't have much in common with me. Mm-hmm. Because having a lot in common with you, I don't think is really all that necessary to building a strong therapeutic base. So while on face value, we might not have a whole lot to connect on, what I try to do is see past all of that and connect to the one thing that all of us do have in common, which is each of us has the need for love and belonging. That is common across everybody, and that is something that everybody needs and everybody can connect on. And so when I find out how a client connects and what it means to belong and what it means to be loved, we can easily bridge that gap.
Yeah, that's awesome. And then how do you tailor your approach to meet each client's unique needs?
Yeah, so I mean, of course, it's not a one-size-fits-all type of deal. And so what I focus on more than any specific modality or treatment goals or anything is just getting to know the person in front of you. What makes them tick? What's their personality? What are their strengths? What gets them out of bed in the morning? What motivates them? And once I know them, I can better tailor my approach to meet that specific person. That's something I like to say is that you treat the person, not the disorder. You treat the person and not the problem.
How do you handle situations where a client is resistant to counseling?
I think we first understand that resistance always means something. Mm-hmm. More likely it is a protective factor, a way of someone protecting themselves. They likely have been hurt by people in their life. They might have been hurt by other therapists. And I think of resistance or unwillingness to engage with their therapist as like wearing a set of body armor. And they had to learn to put that armor on because somebody could punch you in armor and it's not going to hurt. Mm-hmm. And so rather than forcing the client to take off the armor as soon as possible to work with you, talk about what that armor had, like what purpose that armor served for them in the past. How has that protected them? And spend time validating and honoring it before trying to even have the conversation about taking it off. I think the person needs to be able to view their therapist as somebody that honors their whole self and validates their experiences rather than seeing them as a problem.